Hello, my name is Arthur Brooks, and today we are going to be discussing the peer review article called Diabetes in Young Adult Men, Social and Health Related Correlates. So, for the background of this article, um, basically talked about diabetes as being a global public health issue. It's associated with various different disabilities, morbidity and mortality risks, and substantial healthcare costs. Risks are anywhere from obesity to alcoholism to insulin sensitivity, those type of risks. It's a really big concern throughout the entire world. In this particular article, it will be in Australia. So we'll get more into that later. But the concern is the fact that its prevalence is rising, and particularly in the young community. We're talking about members 18 to 49. Uh, the data doesn't really show that in a lot of research, but this is one of the studies that's been conducted in recent years that talks about it and brings it to light. So the objectives of this study pretty much were there's a baseline. They used a famous survey system called 10 to Men. It's a national longitudinal study on male health to investigate the social and health related correlates of self reported diabetes in younger adult males, with the view of identifying a subgroup of Australian males and a priority risk to target for disease prevention efforts and optimal management of diabetes in young men. As far as the population goes, it was a population of Australian males. Started out from age 10 to 55 back in 2013 through 2014, but over time, as the study was being, uh, I guess, conglomerated and compounded together, they narrowed it down to 18 to 49-year-olds. But the sampling plan was designed to oversample males living in inner and outer regional areas, both in the inner city, the rural areas, a lot from all different types of socioeconomic backgrounds. In regards to the type of study, it was a cohort study. Um, Again, it was the information was taken from the 10 to Men survey system. Investigated the social and health related correlates of Australian males aged 18 to 49, as discussed earlier, that reported being diagnosed with diabetes. So specifically, these were the target population that was used. In regards to the study sample, it was over almost 16,000 Australian males that were studied. Um, the strategy that they used for recruiting these males, again, like I said earlier, it started with age 10 to 55-year-olds that were recruited, and over time they narrowed it down to 18 to 49-year-olds. A total of 104,484 households were approached, from which 15,988 Australian males were recruited, and this resulted in a 35% confirmed in scope for all these males. All right, the statistical analysis that were performed, in regards to descriptive statistics, there was a proportion of Australian males that were particular social and health related characteristics that were looked at. The association of the social and health related variables with reporting diabetes were assessed. They used logistic regression, and without adjustment for key type 2 diabetes risk factors. The age was less than or greater than equal to 35 years. The BMI was non obese or obese, and some of them were missing. Four variables had less than 5% missing data. Highest education level was 6.5% of the population. Level of physical activity in the last week, the BMI, and before tax household income. All these analyses were conducted using a Stata SE 13.1, which is out of College Station, Texas. The results of these variables and the data that was conducted, there were 11,307 males aged 18 to 49, of whom 11,075 provided data on whether or not they had ever been diagnosed with diabetes, which is 97.9%. A history of diabetes was reported by 334 males, of whom 85.6% reported treatment for or symptoms of diabetes in the 12 months prior to the baseline. After taking account of the survey design and using population weights, this equated to an estimated population prevalence of ever being diagnosed with diabetes to 2.95%, with a 95% confidence interval 2.54, ranging from 2.54 to 3.43%. The conclusion of the study that the authors noted was Australian males aged 18 to 49 and living with diabetes diagnosis are more likely to be socioeconomically disadvantaged and suffer worse health statuses than Australian males aged 18 to 49 years who are living without a diabetes diagnosis. Based on the associations detected in this study, single males living in regional areas who are socioeconomically disadvantaged and or inactive or obese or who have other comorbidities may be an important subgroup to target for diabetes screening, disease management, and prevention efforts. So in regards to the conclusion, they really want to focus on the members that are socioeconomically disadvantaged and who have the risk factors that pretty much link those members to diabetes, whether it be type 1 or type 2. So, as far as the conclusion goes, do I agree or disagree? After reading the study and really delineating the data that was conducted, I agree with the assertion overall. I feel as though the risk factors that were used for the study, they corroborate with the evidence. I feel as though some of the main variables such as cost of treatment, patient education, dietary guidelines, they all play a huge role in the conclusion of the study. And I also find it very interesting that Australia, at the same issues going on in Australia are going on in America today, which shows that diabetes is a huge issue throughout the world, and especially in younger adults nowadays. I did see a couple of biases within the study. Not necessarily a recall bias or anything like that, but I just saw that the variables within, specifically the socio-demographic variables, were they were extremely broad. I felt that the study it should have differentiated between type 1 and type 2 diabetes. That should have been an issue that was delineated, that was explained a little better. It created a margin of error. And I also feel that the analysis was based on self-reporting data, which could be skewed in a lot of different ways. Other considerations throughout the study, I also feel that racial considerations should have been noted. I should have felt that they could have differentiated between the racial or ethnic backgrounds within the country of Australia. I think that would have broken down the data a little better. As far as an ideal study design, I feel as though a cohort study design is perfect for this type of issue, showing relative risk and odds ratio results. And that is the conclusion of the study. I hope I enlightened you all on the issue of diabetes within young adults. This is the reference that was used. Thank you all and have a good day.